Hypothyroidism, or low thyroid function, may be the most undiagnosed or underdiagnosed medical issue in modern medicine. Hypothyroidism affects over 30 million Americans, yet only a small percentage of these patients receive adequate treatment. The thyroid gland is located in the front of your neck, just above your collarbones. It contains two lobes and typically is difficult to feel unless it is enlarged. The thyroid gland produces thyroid hormones. Yes, there are more than just one thyroid hormone. They include T1, T2, T3, and T4. Each of these four thyroid hormones are nearly identical, just varying in the number of iodine molecules attached to each formulation. T1 has one iodine molecule, T4 has four iodine molecules, and the like. Although these molecules look a lot alike, they have far different actions and degree of potency in their effect on your body. Hypothyroidism is an underfunctioning or low thyroid function. Hypothyroidism is much more common in women than men and often related to the production of antibodies that function against your thyroid. These are called autoantibodies. This form of autoimmune hypothyroidism is called Hashimoto's thyroiditis. Thyroid hormone is critical for your health. Thyroid hormone is your metabolic governor. It sets your metabolic function. It also acts as your body's thermostat and controls your body's temperature. Thyroid hormones are a major component of your body's ability to make energy and control your weight. The common symptoms associated with hypothyroidism include fatigue, weight gain, especially unexplained weight gain, brain fog, dry skin, hair loss, cold hands and cold feet, constipation, infertility, menstrual irregularities. I see patients every day that have seen their primary care physicians with many of these symptoms. Often their doctor may suspect hypothyroidism as a problem and order a blood test, typically a TSH or thyroid stimulating hormone test. The test comes back normal and the patient is told that their thyroid could not be the problem for their symptoms. No further investigation is done. The next step I see is that frequently the patient is told their symptoms are related to depression, anxiety, and some form of prescription antidepressant may be of help. Unfortunately, the patient knows that something else is wrong, and it leaves them feeling that their problems are all in their head. Nothing could be further from the truth. A proper and complete thyroid assessment requires the following blood tests: a TSH, free T4, total and free T3, reverse T3, thyroid antibodies. These 6 inexpensive tests allows for a complete thyroid assessment. It allows us to completely assess your thyroid function and find out if it is indeed normal. Physical findings associated with hypothyroidism include thinning of the lateral third or outside of your eyebrows, cold hands and feet, thin, unhealthy appearing hair, ridging of the fingernails, teeth indentations on the side of the tongue, a pasty skin complexion, swelling of the face, ankles, or legs, dry, scaly skin, or persistent eczema. I would encourage you to go to the Test Your Health section of our website and take the thyroid test and see if your symptoms are indicative of low thyroid function. The Wycoff Wellness Center takes a different approach to the diagnosis of thyroid problems. First, we listen to your symptoms. We have a complete and comprehensive questionnaire before your first visit, and we also evaluate your basal body temperature. We look at your diet and supplements to see if barriers exist in these areas. We then obtain the correct blood test. Also, adrenal hormones and female and male sex hormone levels may be contributing to your low thyroid function symptoms. We will help you determine the appropriate testing you need. Typically, I prescribe a bioidentical form of thyroid replacement. Synthetic thyroid, such as Synthroid or levothyroxine, is not identical to the thyroid hormones your body is used to making. Synthroid contains 100% T4, and assumes that your body can convert this T4 into the more active form T3 at a cellular level. This is a big leap of faith, as many people do not perform this conversion well. Common barriers for T4 to T3 conversion include deficiencies of the minerals zinc or selenium, or imbalances in hormones such as estrogen and progesterone. I typically prescribe Armour Thyroid, which contains both T4 and T3. Armour Thyroid is available at most conventional pharmacies. We can also obtain compounded forms of porcine thyroid through any reputable compounding pharmacy. We will work together to find the correct dose of thyroid replacement. Your needs will be based on your symptoms, not just on your blood test. What is important to me is how you feel, not what the paper with your blood test results shows. We will work together to find the appropriate thyroid dose that you need. By engaging in your health, we can determine how to get you back on the path to health and wellness naturally. Please take time to browse through our website for more detailed information about hypothyroidism. Contact our office by phone or email with any questions. Take the next step to improve your health and wellness naturally.